Been seeing a lot of visual vestibular mismatch cases in the last couple of weeks. I wanted to take a moment and break some of this down. People can develop something called motion sickness, and it's a common feeling when people get a little bit sick or nauseous when they're on a boat, or they go on a ride at Disney or Universal, or they go and sit in a car and they're reading something while they're sitting as a passenger in a car. And people will develop these feelings like the world is kind of moving a little bit more than they want. They feel this sense of head pressure coming in, and most importantly feel this sense of nausea coming on where their hands or palms might get a little bit sweaty, or they develop some of that nasty feelings inside of their mouth. And it's a big problem for a lot of people who have vestibular disorders, but it could also happen when they don't have an active vestibular disorder. The idea is that in order to get your sense of spatial orientation, we rely on a few senses in particular. You have your vestibular sense, which is in your inner ear. You have your visual system, which is from your eyes. And you have your proprioceptive system, which comes from your skin and muscles, particularly in the lower extremity and feet and ankle. But you have some important receptors that are coming from your neck. There's no problem if all of your senses agree on what's going on in the world. So if you are moving around in space and your eyes, ears, and your muscles are all saying the same thing, then you don't have any problems. Everything is usually going to be pretty good. But if your senses start to disagree, like if you are sitting in a car and you're looking at a book and the world is moving around you, but you're staring at a stationary book, and you feel this sense of movement that's happening, then you're going to lead to this mismatch between what you are actually feeling and what you are seeing. And the brain has to decide, does this match with my previous experience? If your senses disagree and your brain is struggling to figure out what's actually going on in space, then you're going to develop an autonomic response in which your brain stem, particularly the areas of the brain stem that control the emetic response that trigger nausea, will start to become more active. In normal circumstances, your body weights these different senses a little bit differently. So your eyes are going to have a different weighting system than your vestibular system. Your vestibular system is going to be weighted differently from your proprioceptive system. But whenever we have a problem, like if we've had a vertigo attack or we suffered some type of event that affects some of our senses, then we're going to start to reweight these senses, possibly inappropriately. What we see in our office is that vision often becomes too heavily weighted, meaning people develop a visual dependency. So their world around them is heavily dictated by what they're actually seeing. So if your brain is relying too much on vision, then anytime that your eyes experience a lot of visual emotion, like if you're watching trains go by, or if you see a really busy type of a scenery instead of a movie, then your brain is going to think that you're moving, even though the rest of your body says that you're not moving. So a big part of our rehabilitation process for these patients is to try to eliminate that visual dependency, which can get them on the road to feeling a lot less nauseated.